Hi, this is Dr. Kronowitz and welcome to What's Hot in Plastic Surgery. On this segment, I'd like to discuss the topic of breast augmentation, which is one of the most common cosmetic procedures within the United States and throughout the world. There are three basic approaches that I take to breast augmentation. The most standard approach is the use of using breast implants, and within my practice, I use the most sophisticated, innovative implants that are referred to as shaped implants. I think they produce a result that is very natural and really has no comparison when compared to the standard round breast implant. I think this leads to incredible enhancement and augmentation. The other category I'd like to talk about is the use of shaped breast implants plus the use of fat graft to be applied overlying the implant in order to lead to a more natural result. This can be especially important in women who are deficient of fat in certain areas of the breast, especially in the upper chest wall and in patients with thin breasts. It can lead to even a much more natural result. In addition, it does lead to some rejuvenation in and of itself within the breast skin, which can stretch over time, especially in children who've undergone childbearing, and is an excellent enhancement, and I perform it in many of my patients who prefer implant augmentation with the addition of fat grafting. Now, a new area, really exciting area that I'm doing now is I will augment my patients using their own fat only. This does usually require several sessions of real quick in and out ambulatory type surgery in which I liposuction fat from other areas of the body. I filter the fat and I inject the breast. Over time, that breast will enhance with natural breast tissue and fat tissue with the creation of new stem cells without the need even for an implant and the potential complications in some patients. But actually, this is a very exciting area, and I, within the next several months, will be publishing a paper within the Journal of Plastic and Reconstructive Surgery, which is the most up-to-date and extensive study looking at the safety of injecting fat graft or stem cells, which is essentially the same thing, into a woman's breast, and it did not show any increased risk for breast cancer, which has been a concern of many physicians. So this is an excellent way to go, and in my opinion will be a certain significant amount and play a significant role of breast augmentation within the future. With breast augmentation, it's also often very important to perform a breast lift. This is some of the most neglected area of breast augmentation when I see many patients who come to me after undergoing previous breast augmentations, and there's several problems that I often tend to note. One of the problems is the patient never got a breast lift in association with their breast augmentation, especially with implants. And over time, the breast implant will bottom out and they'll be very stretched out, often with the nipple staying high. This is a condition called pseudotosis. In many of those patients, I do a correction. I place a sling in order to maintain the position of a new shaped implant, remove the lower skin, perform a lift, and like I said before, in addition, we'll often perform fat grafting to enhance the outcome of it, not only to add new tissue, but to rejuvenate the overlying breast skin, which over time can be stretched thin. So breast augmentation, to summarize, is a very, very exciting area. There are a lot of new happenings that are going on. It's one of the most common cosmetic procedures out there. What's very exciting in my practice is the use of using fat graft only in order to enhance a woman's breast without the need for breast implants. Within the area of breast implants, I use the most sophisticated new implants on the market that are referred to shaped implants that are not really being used by many plastic surgeons out there. I have extensive experience using them and feel that in comparison to a standard round shape, it produces a much more natural result and is certainly the way to go and will become the future of breast augmentation. Thank you for tuning into this segment of What's Hot in Plastic Surgery, and I hope you tune into other segments. Thank you. Bye-bye.